let's take a look at the progression here of chronic kidney disease. It's something that you need to understand, you need to look at it, and also you need to understand that this is why the nephrologist and the doctors are here. Doctor, first of all, let's walk us through this here in the progression, going from normal to risk and moving on.
Right. So you start with normal kidneys, and patients that have certain diseases like diabetes and high blood pressure, things that we know can put the kidney at risk for or damage. We can stop or we can control the progression of chronic kidney disease from as early on as the diagnosis of a diabetes or diagnosis of high blood pressure. If we don't and we allow those things to progress, then they'll start to cause the damage in the kidney. And the damage first is not noticed necessarily in places other than the blood test or the urine test. So before the people actually have overt kidney function decline, they'll start to have the damage. If we were to take a microscopic piece of a kidney in someone who has uncontrolled diabetes or blood pressure, even though they may have normal blood tests in the beginning, we can still see damage. And so we really want to start to catch people between the increased risk to kidney damage before they end up with abnormal findings in the blood with reduced kidney function.
Between increased risk and kidney damage, are we talking about irreparable damage?
So some of it, long-standing damage, is irreparable, but a lot of it can regain health. The kidney has areas that can regenerate. But the point is that you cannot let that diabetes hang around for too long. You cannot let that high blood pressure hang around for too long, because the damage that it does cause over time will be irreversible.